So, as you mentioned, I'm going to talk about implementation of the Sustainable Development Goals, or rather the unimplementability of the Sustainable Development Goals. And I come back to what I mean by that, but first a little bit more of context, because the talk that I'm giving is inspired by the work that I'm doing at the University of Oslo, where I'm leading a center for, you can see it here. It's a center for excellence in education called Center for Sustainable Healthcare Education, where we try to inspire critical thinking around the SDGs and the sustainability agenda among health professionals. And we do not talk about implementation because we are challenging that notion. But still, we are drawing in our different approaches to these issues. We are drawing on a kind of combination of implementation science on the one hand, and more medical humanities and translation studies from the humanities on the other side. And I'm going to come back to all this, but a little bit of context so that you know where I'm coming from, because I'm a professor of medical humanities, and my background is in the humanities, and that's how I enter the field of health. So this is the plan for the coming hour or so, 45 minutes. First, I'm going to give some background about the Sustainable Development Goals, much of which you probably know already, and their impact on health, and also a little bit about their underpinning principles, just to frame the lecture. Then I'm going to go more deeply into what you mentioned, Sarah, the politics, and the politics of sustainability, the politics of the SDGs, the politics of implementation. Then I'm going to say what I mean by unimplementability and the paradoxes linked to the implementation of the SDGs and why it is so difficult. And I'm going to use the case of COVAX and TRIPS, the TRIPS agreement, to discuss or to illustrate some of these issues. And then I'm going to end by recommending something, or a more kind of critical approach to sustainability studies, also influenced by what I have termed translational humanities as opposed to translational science. So that's the plan. And here are the SDGs, and I suppose that you have already been touching upon them. Adopted by the United Nations in 2015, as you know. Very ambitious goals that serves as a foundation of the so-called Agenda 2030 for Sustainable Development, which aims to reduce social economic disparities while enhancing nutrition, health, and education for all. And it consists of 17 goals, as you can see here, and 169 targets. And these goals, they replace the previous global goals, the so-called Millennium Goals. And they are also distinct from the Millennium Goals in some important ways. First of all, they are applicable to all countries, at least in principle, to all countries equally, and to all sectors of society. So the SDGs do not distinguish, for instance, between developing and developed countries. All countries are in principle developing countries, in the sense that they need a push towards the same push towards sustainability and sustainable development. Another kind of principle that is distinct for the SDGs is also that they at least on an intentional level, they address the root causes of the problems. So the causes of the causes, so to speak. They address the root causes of poverty, of inequity, climate change, and ill health, not the symptoms. And that also means that all these different issues need to be looked at as interlinked. They are because that's what it implies to look at the root causes, to look at what kind of the kind of underpinning system that all these different problems are part of. So that's also a very important kind of principle underpinning the SDGs, that they are all interlinked. You cannot address good health and well-being, which is SDG 3, without thinking about education or poverty or gender equity or all the other, in principle, all the other SDGs, because they are part of the same complexity. And it's exactly this complexity which the SDGs aim to address. So here are the kind of key principles that underpin the SDGs. First of all, the systems approach that I already mentioned, that all the goals are interlinked, and also these three famous dimensions, ecological, economic, and social sustainability, are fundamentally interlinked. You cannot address ecological sustainability while also at the same time looking at social development, at economic development. You need to address all these considerations in context, so to speak. And then, so the systems approach is one kind of fundamental principle. Another one is the anticipatory approach, or the future-oriented approach. And that goes to the heart of the definition of sustainable development as it was first coined by actually my former prime minister in Norway in the 80s, Gro Harlem Brundtland, as development that do not compromise the needs of future generations. So it is the kind of this intergenerational justice, or using the future as the yardstick in order to look at decisions today, is fundamental to the sustainable development and the SDGs. What are the potential future consequences of current actions and current developments? And the final principle, which is also important, is the equity approach. I think that, well, the SDGs and sustainability is fundamentally linked to equity. And maybe the most cited expression in the SDGs is that leaving no one behind. That is a kind of overarching principle that it should be a development that leaves no one behind. So it should be encompassing everyone equally. And these are good principles. I mean, these are important principles, easy to agree with. And this has also been translated in different ways into the field of healthcare. And here is an attempt, at least one way that we talk about sustainable health within the context of health. In my unit or in my team, we talk about sustainable health as an approach that addresses the overuse, the misuse, and the unequal use of resources with health benefits. So misuse, that we are misusing planetary resources and pushing planetary boundaries. Also in the health sector, of course, with and that needs to be taken into account. Overuse in terms of, and this it's linked to misuse, but its overuse has to do with overtreatment, with overdiagnosis, a call for choosing wisely that has come into healthcare recently. And again, unequal use equity, that sustainable health is fundamentally linked to global and to intergenerational equity. So all these considerations are coming into the field of healthcare in different ways. And here are some of the shifts that we have seen over the past 5 years or so in the field of healthcare that can be linked to this framework or this overarching way of thinking about health in terms of sustainability. So first of all, this more kind of anticipatory gaze through focus on prevention, promotion, and preparedness. So the future, not only treatment of existing problems, but looking ahead. And same approach to, I already mentioned, the focus on overdiagnosis, overtreatment, and the need to choose wisely, which is as you know, an international campaign in healthcare. Then the more kind of social aspects of sustainability comes in through the emphasis on universal health coverage and also social determinants, the importance of social determinants, that good health or bad health for that matter are created far beyond the health sector. It has to do with larger social and cultural contexts. And this is also a kind of an awareness that can be traced back to some of the ideologies underpinning the SDGs. And then, of course, the whole kind of environmental aspect of health linked to the lower carbon footprint and also environmental consequences of healthcare, but also broader notions such as planetary health and also One Health that looks at human health in a larger environmental context. And again, all these ideas are, at least for me, good ideas. I'm not against it. I'm running a center of sustainability in health, so I think these are good things. But still, I think that, like many other concepts that we think of as like inherently good, such as evidence, such as empowerment, such as implementation, knowledge translation, things that we think of as good and positive, inherently positive ideas, they also need to be scrutinized. And that is in a sense the kind of overarching topic of this talk, that we need to attend critically to this agenda that has many good, that is based on many good ideas, but still we need to attend critically to it, and that is what I'm going to focus on in the remaining bit of this talk. Because it is, even if these ideas are good, and even if the SDGs are undeniably very, very important, they are failing. Because we are now halfway to 2030, where all these very ambitious goals are supposed to be accomplished. And most of them are actually failing. And in this paper, Bierman and colleagues, they have analyzed the implementation of the SDGs from 3 different angles: discursive, to what extent do people talk about them; normative, To what extent has there been legislative action, and institutional, to what extent have actual programs been implemented? And they conclude that in most cases, implementation of the SDGs has been limited to talk, while action at a deeper regulatory and institutional level has been extremely limited. And that is what I'm going to zoom in on now. Why is it so? Why are these goals mostly failing? And in order to search for an answer to that, of course, very complex question, I think we need to go back to the issue that Sarah mentioned in her introduction about politics, about the politics of the SDGs, and also the politics of the SDG implementation. And the problem with an alleged universal agenda like the SDGs is that it's, by insisting on its universal character, it tends to portray itself as, or portray humankind as a single political group with a single political project. It portrayed itself as apolitical in a sense. It marginalizes political difference. So this has made Telleria and Garcia Arias to talk about the Agenda 2030 as a depoliticizing political device that makes an inherently political issue look not political. So this way of marginalizing the politics of its own functioning, of its own implementation, is in a sense a very problematic aspect of the global agenda.
The remotes. This one.
Are we good?
Yeah. Don't mind me.
Okay.
Questions?
No, it's all about the tech.
It's all about that. I thought that someone were protesting against the content.
Okay.
Tell me if I can continue.
Yes, continue, Eivind.
I can continue. Okay. So this issue related to the politics of the SDGs, the politics of SDG implementation, is what I have recently tried to explore from different angles and drawing on various methods. This is I think you mentioned Trish in your introduction, Sarah, and Trish and I, we have written several papers on this together. This is one of them. Missed SDG targets from trying harder to engage in critically with paradox and conflicts. So what we try to do here, or try to argue here, is the need to bring politics back into policy implementation, to bring politics back into this discussion about what implementation of the SDGs is about, and not reducing the SDG implementation to a technical and metrics-driven process. And in this article, we emphasize several different paradoxes or conflicts inherent in the SDGs and in the SDG implementation plans that we think that it's very important to discuss openly and to create a dialogue and democratic dialogue about. And one of these paradoxes is the kind of double voicing of the SDGs. We call it double voicing, and the we the people, who is talking, who is pledging that no one will be left behind, and the we that is created in the SDGs blurs the distinction between, we argue, between a promise on the one hand and an obligation on the other hand, which is problematic, because on the one hand, the SDGs is based on a promise. We pledge that no one will be left behind. It is a promise of global solidarity. But if you read further, it's gradually transformed into an obligation. It will be for all of us to ensure that the journey is successful. So here's a different we, which involves governments as well as parliaments, United Nations systems, and so on and so forth, and all people. So there is a kind of a unclarity in the SDGs between, is this a promise or is this an obligation? Who is giving the promise? Who are responsible for accomplishing that promise? And this also has consequences for, and this is something that we point out in this short paper, for how we frame accountability for the SDGs. Because the mechanisms of accountability becomes very unclear. Because when everyone, we, is responsible, no one is responsible. So that is one of the kind of political dimensions of the SDGs that are often overlooked as we see it. I don't know if you know this man, Paul Farmer. He's one of my heroes. He passed away a few years ago, unfortunately. He was a Harvard professor and also the founder of the organization Partners in Health. And he wrote extremely, I think, critical and interesting things very early about sustainable development and the problems of the kind of dilemmas inherent in how we frame sustainable development and sustainability in a health context. And he points out that sustainable development and sustainability is often used as both a gift and a weapon. Again, a paradox. On the one hand, it's a gift, it's a sign of solidarity. On the other hand, it strangely becomes a weapon. Because on the one hand, it's this returning promise that no one shall be left behind. So in that sense, it's global solidarity. It's a gift. But then on the other hand, he points out, it becomes a weapon in the sense that medical treatments and technologies are often considered as unsustainable in the regions where these treatments are the most needed. And this is one of his quotes: the kind of care that we receive isn't affordable or sustainable for them, the poor inhabitants of indebted countries. So the sustainability that we take for granted is not necessarily accessible for everyone globally. And together with Paul Farmer, we wrote a piece back in 2016 where we looked at the historical evolution of the concept of sustainability in global health, looking at policy documents. And what we point out in this short piece is that we can trace a kind of a development of the concept from implying entering assistance to denoting self-assistance, to focusing on self-assistance. A transition from kind of a focus on solidarity and from looking at sustainability as an objective, as a joint objective as a goal for development aid, and then more and more looking at it as a benchmark for development aid. And Paul Farmer, he pointed this out this problem already in his writings in the early 2000s, and especially in his discussions of HIV medications and how HIV medications like PrEP and other things were rolled out globally. And in these discussions, the kind of treatment that we take for granted in the global north were then considered as unsustainable in the south, where these treatments were the most needed because of an alleged lack of infrastructure, lack of capacity in the countries of the south. And this is what Paul Farmer points out in late 90s, early 2000 in the HIV medication. But we see, and I will come back to that, many of the same kind of discourses reflected in the discussion about the COVID-19 vaccines and in the COVAX programs and the TRIPS agreements and the patents related to COVID vaccines. That again, it was argued that there is no production capacity in the South. There is a lack of sustainability. There is a lack of infrastructure. Therefore, it cannot be implemented in a sense. So what we argue in this paper, and which has become important also for how we think around these issues, is that there is a kind of movement towards a neoliberal idea of sustainability, where that creates a kind of a new concept, like in the Middle Ages, of a worthy needy, where the worthy needy is the person who takes care of themselves, who have the ability for self-assistance. I can't see you there, but is everything okay? Do you have any questions at this stage?
Yeah. Hi, Avent. I'm here at the back. Let me just come up. Anyone, you're covering a lot of ground, actually. So really good to check in. Anyone got any queries or questions for Avent who likes to discuss things going on?
Sorry.
It's quite a radical difference that you're suggesting. It's quite a challenge to the prevailing norm and way of thinking about SDGs. So
it is, yes.
Yeah. Do you want to just say your name, Imran, when you
Imran.
give a wave, then he knows where you're coming from.
That's fine. Nice to meet you. So, yeah, thank you for the lecture. Just a question in terms of why has that shift to self-assistance taken place, especially from, I guess, the idealism of when the SDGs were first developed, and before that, the Millennium Development Goals, to, I guess, what you're saying now is that self-assistance where everyone's responsible for taking care of themselves. And that's definitely kind of the prevailing winds that we're seeing in international politics. But I guess just your thoughts on how did we get from that idealism to where we are now?
Yeah, thank you for that question. I think actually my answer would be that this tend to happen with all big ideas, big concepts, that they tend to be co-opted and used for different purposes. They start on from a good kind of intention. This is something important. It's a radical shift that is needed. And then because they are become political and they start to be co-opted and used for different political interests. And that is why it's a very important question, because that is why I think critical sustainability studies is so important. Because we cannot contribute to these extremely important shifts without at the same time questioning the tools and the frameworks we use to get there. And I really think that this is a kind of process that is inherent in many political, big political movements where concepts and ideologies become co-opted and used for different purposes. But thank you for the question.
Anyone else?
I haven't finished yet. This is just
Can I just follow up, Eyvind, and just go a little bit deeper on what you were saying?
Yeah.
So just to go back to the inception of the Millennium Development Goals and then the Sustainable Development Goals, was there any discussion about power and politics and the strength and influence of neoliberalism in the world and how it does shape agendas in those early days? Or is this something that's only come out later on as we've seen the SDGs really begin to fail and there have been questions about impact? Was it ever part of the conversation?
That's a very good question, and I'm not sure, but I think at least already in the early discussions about the SDGs and when the SDGs were approved by the UN and so on, there were critical voices that were raised already at that time, pointing to these things and the importance for some critical voices. But I think that it has become clearer now. I think this whole strand of research that we call critical sustainability studies, I think it dates back to maybe 2019, 2020, where people started really to talk about the importance of having a really emphasizing this kind of critical approach to sustainability studies. But I don't think I don't think that it was on a kind of political level. But it's actually a very interesting empirical question that you're raising, whether this was part of the discussion leading up to the SDGs, from the MDGs to the SDGs. I can't tell.
The reason I ask is because there was already a lot of dissatisfaction with process and approach, and with transnational organisations, with the politics of it. But it seemed to me that it was quite siloed. So that's actually, there's the kind of, let's say a global elite. Discussing one set of things and a set of critical discussions happening elsewhere, and the two not necessarily meeting.
Yeah. Which is very important in itself to integrate those two discussions.
Indeed.
They still do happen for a large part in silos, I suppose. Shall I continue a little bit and then we can...
Okay.
Just one more question.
Yeah, of course.
Can you introduce yourself, Chidera?
Yeah. So my name is Chidera Chukwu. I work with the FCDO in Nigeria. So I was just wondering, just reflecting on the topic so far. Given what's happening currently, the shrinking donor landscape. I mean, the US has pulled us support. Most developed countries have begun to announce reductions in their order and shifting that to defense spending and all of that. And when we're just about 5 years away from the finish line, was this all in the plan from the very beginning? What changed?
Yeah, you mean what is in the plans already, the kind of shifts that we see, the political...
Yeah, the shift that we're seeing now, right, was the plan all along when the SDG was formulated, right, by countries. Was theirs, do you have any insight as to whether there was plan to sort of reduce order? The 0.7%, which was something that was
Yeah, I see.
So was there a plan, somehow, somewhere to say that at some point before 2030, we are going to begin to reduce our support to developing countries, in the realization of the SDGs?
Yeah, I see what you mean. Thank you for raising that question. Well, I don't have any evidence that could support that kind of theory, and I honestly think that the problem is more that, again, it has to do with co-option, that you start off with a radical idea, and I think also in part with very good intentions. Like I started with, I think there were also when these global goals were approved, I think that was an important shift. I think it was a need, a kind of an acknowledgement that there was a need to all this thinking about leaving no one behind, to focus on these things. But then I think that and this is exactly my point, that the concept was used in order to defend other political projects that were completely different and that were about reduction of assistance and not the increase. And that is exactly what happened with this shift towards self-assistance and these kind of neoliberal ideas of sustainability as a benchmark and not as a joint goal of solidarity. I think that's a way of co-opting the concept of sustainability that was not necessarily intended from the beginning, but that very, very quickly became relevant and which has in part led to many of the developments that we see happening today.
Okay, thanks, David.
Thank you for the interesting questions. But I will continue a little bit because I have a few arguments left. So
over to you.
Okay, let me see. I will find my slides. Here we go. So yes, so going a little bit more into the question about following this idea about neoliberalism, because this neoliberal ideology that we see here in the conception of sustainability is also very much reflected in how implementation of the SDGs is framed. Because the means of implementation that are also described in SDG 17 on implementation are largely based on a top-down management and governance of an assumed kind of delivery pipeline that runs from a global vision for SDGs to local impact through various evidence-based interventions. And implementation frameworks that focus on efficiency, fidelity, monitoring, using a standardized set of mostly quantitative metrics has been used in order to conceptualize this process. And this is something that we, again, Trish and I, tried to challenge in an article that we wrote last year in the Lancet Global Health. Why are the Sustainable Development Goals failing overcoming the paradox of unimplementability? And here we argue that this neoliberal notion of implementation that is very, to a large extent, built into the whole concept of implementation science is unproductive. It is unproductive in the sense that it hinders rather than supports implementation. And in our view, implementation interventions are not responses cannot be seen as responses to pre-existing issues, because these issues are framed by language and they are framed by numbers that constrain how we think about them. And we in that context, we talk about implementability or unimplementability, because in this implementation chain that we looked at, that chain makes, in a sense, implementation or implementability into a norm. Implementability is the point of departure. If you do things right, if you behave rationally, if you act as a good neoliberal modern subject, the result will be implementation. Implementation will be accomplished. So, and the result is that unimplementability, when things are not implemented, it's often seen as a failure, as the result of a subject not being capable of implementing. And we argue that we need to really look at this in a completely different way. We look at, rather than looking at implementability as the kind of norm, as the point of departure, we need to look at unimplementability as the point of departure. Because if we follow that logic, if we look at implementation in the way that implementation science defines for us, if we follow that logic of the chain, it will lead to unimplementability. That is our kind of radical hypothesis. Because SDG implementation plans become unimplementable because they are framed in particular ways. They are monitored using inflexible and questionable metrics, and they are enacted in bureaucratic ways that obscure key perspectives and important ethical questions. So we need to stop looking at implementability as the kind of point of departure, as what happens if people behave correctly, and rather look at the unimplementability that is built into the logic of implementation. But if we look at it this way, unimplementability can also be something productive. It can lead to productive discussions rather than failures. And we link this to the question of and the role of metrics. This is a very famous and very, very interesting book, Metrics, What Counts in Global Health. And according to Adams, numerical data has dramatically shaped, and she accounts for this in this book, dramatically reshaped the field of global health by acting as a defining tool, deciding what matters and what doesn't, thereby also influencing our comprehension of what is known and what is visible. And metrics, she says, metrics will once and for all get us talking about evidence instead of politics. Metrics today are assumed to be able to give us a value-neutral and political unbiased way of talking about health problems and their solutions. And here we come to what we talk about as the unimplementability of this, of the implementation framework of the SDGs. That it presents itself as non-political. It presents itself as value-neutral. It presents itself as politically unbiased. And by doing so, it can never succeed. Because implementation is fundamentally about politics. It's fundamentally about culture. It is fundamentally about values. So we so to return to the question of countings and how that might also be used and misused in the context of the SDGs. One example that we analyze in this paper is the counting of how many people have been housed in high-rise social housing, which is central to SDG 11. That shifts attention away from, and this kind of quantification of the number of people shifts attention away from the quality of life experienced by people living in these structures, which is of course very relevant for SDG 3 on health and well-being, but it's not systematically measured. So this also shows how the implementation of one SDG and the metrics used in order to measure the accomplishment of one SDG can constrain and even undermine progress towards another SDG. Moreover, and we argue in this paper that implementation often happens at the expense of someone. And we use the 15-minute city, the idea of the 15-minute city as a case. This is an urban planning concept that where all essential services are accessible within 15-minute walk or bike ride. And the goal is, of course, to reduce car dependency and lowering carbon emission, and also health-wise to promote walking and cycling with both environmental and health benefits. But what seems to be a universally acclaimed right is not necessarily to everyone's benefit, because the center of a city might be readily transformed by making some streets traffic free, allowing those who can afford to live downtown the option of cycling. But the sprawling suburbs of megacities, where most of the less affluent population live, pose a much greater challenge, as we can illustrate it in the experience of Shanghai outlined in this quote. That maids, laborers, masons, gardeners who serve in the informal sector are often migrants. Their homes are scattered settlements on the periphery of affluent neighborhoods and cities. These populations make long commutes to their places of work, and a 15-minute city does not work for them if urban planning does not focus on affordable housing. So the 15-minute city may achieve a more fulfilling and sustainable lifestyle for some at the expense of worsening disadvantage for others. We risk creating a 15-minute ghettos, where low-income urban areas, which concentrate the most vulnerable, who already face higher rates of chronic disease, mental distress, social isolation, and so on. And this is what we refer to as the paradox of unimplementability. And how to address this? So in order to address the paradox of unimplementability, we should criticize or critically question so-called objective and abstracted versions of problems and solutions and progress. Acknowledging that there is no single universal truth, a kind of view from nowhere, we must ask not only what these metrics, graphs, and images and stories reveal, but also what issues and consequences do they conceal, especially to vulnerable populations and less powerful groups. And so we need implementation studies that move beyond a purely technical, a purely metrics-driven approach to engage with people's conceptual frameworks, with the values that they hold and the reasons underlying these perspectives. And research must also critically examine the concepts that implementation processes often take for granted. And this requires collaboration with disciplines that are often absent from policy implementation discussions, such as discourse analysis, political philosophy, conceptual history, and so on. And this is what we have tried to do by introducing the concept or the approach of translational humanities as a supplement to translational science. And the aim of translational humanities, as we define it, is to challenge and enhance translation science by incorporating theories of translation from the humanities. And what does that mean? We started to develop this concept back in this paper that I co-authored with the philosopher Julia Kristeva in 2017, where we point out that all knowledge translation is also cultural translation, in the sense that all clinical encounters should be considered as also cultural encounters, in the sense that they involve translation between health as a biomedical phenomenon and healing as a lived experience. And this always happens in processes of knowledge translation. It will always be a process of cultural translation. So we need to bring cultural context back into knowledge translation. We need to, and in a much more fundamental way that is now the case in implementation science, often reducing culture to barriers and drivers of implementation. We need to rethink and reframe implementation, policy implementation, and knowledge translation as a fundamentally cultural process. And we need to bring politics back into policy implementation. And together with Trish, we have also introduced the concept of agonistic pluralism from the political philosopher Chantal Mouffe. And she talks about agonistic pluralism as compared to antagonism, which is negative. Agonism or agonistic pluralism is positive, productive disagreements that happens within a safe, democratic dialogue and frame. So we need to cultivate these kind of productive disagreements around the SDGs, about different framings of the SDGs, about different conceptualization of the SDGs, rather than hiding it under false consensus. And let me then turn to COVAX as a case here that might illustrate some of these general, more theoretical points that we are making. As you know, COVAX was a multilateral effort that aimed to accelerate the development and manufacture of COVID-19 vaccines to guarantee fair and equitable access to every country in the world. And it came to a close in December 2023, partly because it wasn't successful, in the sense that fair and equitable access of vaccines to every country in the world, that simply didn't happen. And why didn't it happen? Well, part of the problem, at least as we look at it, is that unimplementability was built into the framing of COVAX. Because COVAX, or vaccine equity, was primarily framed as a question of philanthropy. And this approach also shaped the metrics that tracked vaccine sales to the global south as sales overshadowing other approaches to the problem. And this is closely linked to another way of viewing this as not a question of philanthropy, was presented by a group of countries that proposed a waiver from the trade related intellectual property rights, the so-called TRIPS agreement, in 2020. They proposed a waiver that would allow low-income countries to produce their own vaccines by lifting the patents. And the interesting thing was that many countries in the global north argued strongly against this waiver. The EU wrote an argument against it, and it was supported by the UK, the US, Norway also. And in that argument, it was emphasized that the only solution was what they called global collaboration. That was specifically understood as a global effort to produce vaccines in higher income countries and to distribute them to the rest of the world. So, and what we see here is exactly the same argument was used as Paul Farmer found in the HIV treatment debates in the late 1990s. That for the countries in the south to produce their own vaccines was considered as not sustainable. So here, sustainability was used as a weapon, you might say. It was not sustainable because countries in the south were considered not to have the production capability, not the sufficient infrastructure, or in other terms, not the sustainability that was required in order to produce their own vaccines. So COVAX was then used as a justification. This is important. So this idea of philanthropy, that it was produced in the south, in the north, and then distributed to the rest of the world, that was used as a justification for not expanding vaccine production capabilities in the global south and not lifting the patents. We did a close reading, my team and I, of this debate, kind of a discourse analysis of these arguments. Just confirming what I just said, that in this argument it is emphasized that there is no indication that intellectual property rights issues have been a barrier in relation to COVID-19 related medicine on technologies, that the real problem, they say, is rooted in the lack of manufacturing capacity in developing countries. So again, it's linked to their incapability of implementing. It is linked to their alleged unimplementability. And that the solution, the measures to tackle current and future supply side shortage must be found outside the intellectual property rights system and include broad and equitable global distribution. So not production, but distribution. So it can only be realized through an act of philanthropy. And they also go further than that, saying that the intellectual property rights system is part of the solution rather than an obstacle, by being one of the main economic incentives to stimulate extraordinary efforts. So COVAX was also in that sense framed in a way that served the economic interests of manufacturers from the global north. So what does this show on a kind of more general level? Well, it shows that in order to achieve sustainability in the way that we talk about it here, a much more fundamental change is needed than we can get through sustainability, no, through implementation. The master tools will never dismantle the master's house, Audre Lorde said. So to create sustainable change, the whole system, the hierarchies, the structures that created the problems we seek to solve must be challenged. And this is where we call for a critical sustainability studies that dares to raise this question: can we promote? Is it even possible to promote sustainable change without dismantling the SDGs? And we need to acknowledge and explore the consequences of speaking on behalf of someone else about sustainability, which is almost always the case in sustainability discourses. And today we published a new paper. It's out today, also with Trish, where we explore this topic further and its consequences for how we teach sustainability to health professional students. And here we argue that there is a need for a shift from translational science to translational humanities, or at least a complementary approach. And here are some of the you can read this yourself, but some of the characteristics that we see in a translational humanities approach as opposed to translational science approach. That's while the translational science is focused on implementation of programs which are based on scientifically tested interventions, translational humanities focus on examination of how problems are framed and whose interest particular solutions serve, challenging dominant actors and giving voice to marginalized populations. While translational science focus mainly on evidence-based solutions, on implementation science, kind of disciplinary background or foundation for translational humanities is critical linguistics, discourse analysis, political philosophy, while translational science focus on methods such as testing of complex interventions, preferably in trials, goal setting, monitoring, and evaluation using mostly quantitative indicators. Translational humanities focus on real-world cases presented with rich qualitative evidence and thick descriptions and narrative methods. And then finally, it is a different approach to conflicts and uncertainty, that while translational science tends to see conflict and disagreements as something that impede progress and can and should be eliminated, and that the goal is avoidance of antagonism and achievement of consensus and a shared vision, and uncertainty is quantifiable and reducible, and the goal is to reduce it and in order to achieve certainty. Translational humanities sees conflicts and disagreement as something that promote progress and cannot and should not be eliminated. And the goal is productive engagement and agonism, which is a healthy pluralism of political frames and positions. And uncertainty is a non-quantifiable and irreducible thing. And the goal is to acknowledge and tolerate this uncertainty rather than getting rid of it. So these are some of the approaches that we suggest, and that was actually all.
Brilliant. Thank you, Eyvind.